That's what we were just talking about.
Good afternoon, everyone. It is 2 o'clock. Welcome to the October 3rd Public Safety and Justice Committee meeting. I am Supervisor Ellenberg, chair of this committee, and we are joined by Supervisor Wasserman, who is the vice chair. To get us going, I'd like to ask the committee members, starting with Chief Garnett, to introduce themselves.
Hi, good afternoon. Laura Garnett, Probation Chief.
Damon Silver from the Public Defender's Office, Assistant Public Defender.
Laurie Smith, Sheriff's Office.
Matthew Fisk, Pretrial Services.
Deborah Ryan, Presiding Judge of the Superior Court.
Good afternoon. Rob Coelho from County Counsel's Office.
Gary Hersig, Deputy County Executive.
And good afternoon, everyone. Sylvia Perez McDonald with the Independent Defense Counsel Office.
Great. Thank you all very much for joining us today. Let's go ahead and move on to receiving public comment. This portion of the agenda is set aside for members of the public wishing to speak or submit a written comment on items not on the agenda but within the purview of this committee. I'll confirm that there's only one card. Okay. Scott Largent, come on up. And I'll ask the clerk to set the timer for 3 minutes, please.
I had a lot of other things I was going to talk about here at my monthly therapy appointment, but I want to talk about what I saw this morning at St. James Park. A man died last night at St. James Park, and right against the side of the mural there, they had the coroner out there this morning. They had San Jose Police Department out there. As you are all aware, I document a lot of what's going on in our homeless community, and I've really started to kind of dive in deep now. And I'm tracking down people's families. I'm figuring out how they got into these situations. And I guess what I'm trying to do is what our county is not doing. I don't think behavioral health is functioning properly. I'm sure Tony Tolis will never talk to me ever again for saying this, but I think she needs to be fired. I don't think it's working out. Joe Simidian's been kind of chiming in a little more, and I don't know if you've noticed that, Susan, at some of the health and hospitals committees. He's getting frustrated. He's not seeing results. It's this constant, this is going to roll out, this is going to happen, this is going to happen. It is not happening downtown. I don't see anybody with a county shirt on. I don't see social workers. All I see is people dying. Okay, that's all I see. They smoke meth, they're covered in poop, they scream, they yell. Nobody's responding. When you wait for law enforcement to coordinate with behavioral health, it just doesn't happen. They don't show up. The right hand doesn't talk to the left hand. And how could behavioral health need the police department to back them up when they're right across the street from courthouses, when they're right across the street from a church, and we're right in the middle of town? I don't think you need that backup. Maybe in a creek, maybe in an encampment. This is very, very frustrating. We had another gentleman that basically was living out in front of our courts. He had a stay-away order. That poor man jumped in front of a train. He's dead too. Now, we kept feeding this man. We were doing compassionate things for him, but we were supporting his alcoholism and his meth addiction. And all we did was give him money every single day. We didn't help this man. We didn't pull him in. We didn't do anything, and now he's dead. And there's another one dead downtown. Why is the county not doing anything? There's a building right across from St. James Park. You guys could lease that right there. You could start showering, bathing people, helping them do, all these things that we talk about. But you're doing nothing if you're not going to lease a facility right across the street. If there's not going to be people from the county out there. You guys could set up a trailer, a tent. You guys could be out there. You're non-existent, okay? All the videos I make, I don't see county employees out there. $526 million. We need to figure something out. We need to figure out fast. That's just very, very sad, very sad. So, thank you.
Thank you. That completes the public comment on items not on the agenda and takes us to the consent calendar. Am I making that beep? I have got two comments on the consent calendar, but I'll first turn to Nancy. Do we have any speakers on the consent calendar? Supervisor Wasserman, I would like to put item 4 On consent, which is to receive a report related to psychotropic medication use amongst foster kids.
Thanks, and I'll make the motion to approve 8 through 17 plus item 4.
I've got one other request, please. I'd like to have us take item 6 out of order and hear it first. That will be the Assistant Public Defender Damon Silver presenting on behalf of the Public Defender's Office on item 6A,
Madam Chair, are you saying hear that before we approve the consent calendar?
right after the consent calendar. Thank
Okay,
you for
then my
confirming
motion
that.
will stand. And you seconded, and we pass it unanimously.
Good job. Thank you very much.
Thank you.
Which takes us to item
6.
6. It's actually not even out of order, is it? Right, okay. Thank you. Okay, reorienting. Thank you. We will move to item 6. And item 6A is to receive report from the sheriff on inmate phone calls and tablets.
Thank you. We have been working with the Public Defender's Office and in the past with the Police Chiefs Association to come up with a policy for inmate phone calls and tablets, and that's part of what we're doing here. And we've been working with Assistant Public Defender Damon Silver on this as recent as today. But I'd like to introduce our staff. Assistant Sheriff Taylor has been shepherding this process through and can answer any kind of questions on selection and scope. Assistant Sheriff Ken Binder has worked with County Counsel's Office, Rob Coelho, on the surveillance policies that are presented today. Director of Administrative Services, Juan Gallardo, will be here to talk about the technology and the procurement process. And also, I understand from procurement, Michelle McCarthy is here to answer any questions, if there's any questions on procurement. Is that right? Okay, yeah. And also, Captain Thomas Duran will be able to explain the process and the procedure for requesting and accessing inmate communications. So with that,
good afternoon. I'd like to begin by reviewing the timeline for the procurement for Jail Inmate Services Program. The RFP was issued in July of 2017. In August of 2018, the intent to award was sent to Legacy vendor. The negotiations commenced from August until the spring of 2019, where TSS procurement worked really closely with negotiating the contract. Then in July, prior to finalizing the contract, a new process for access for all law enforcement agencies was developed. Then in 2019, the board had requested that we provide research and analysis on an inmate phone call subsidy. The scope of the project was to procure phone and tablet services for inmates. It was intended to replicate our existing operations for phone calls and to provide tablets to inmates with educational content. The new contract provides significant enhancements to programs being offered to inmates at all security levels through the introduction of tablets. It will also further reduce the cost of inmate phone calls and other content that inmates will have access to.
Supervisors, you can see there's also some points about the surveillance policy on this slide, and the sheriff did update the policies for both the phone calls and the tablet services, and there's just a couple of main adjustments, and one was in terms of inadvertent recordings of privileged communication. If that's discovered, we had initially in our policy said that we would promptly delete those, but we changed it to immediately. The other really more substantive change was that we defined what privileged communication is. The policies for both phone calls and tablets restrict the monitoring, listening to, or recording of any type of privileged communication. And our policy itself now defines the privileged communication as attorney-client communication, physician communication, and clergy communication. It's also important to note that on our tablets, currently we are not allowing the ability to communicate via phone calls, emails, or messaging. And there is, in the policy itself, we have restrictions against any of those privileged communications in those manners from being monitored or recorded. But right now, it's our understanding that Legacy does not have the technical capabilities to restrict those. So we're not allowing those functions to be turned on. And if at a later point that becomes available, then we will bring the policy contract back to PSJC and the Board of Supervisors for an update indicating that those abilities are, the restriction abilities are available.
And if I could just add, the RFP was silent on that being a specific item, so that in fairness to the vendor, that was not a requirement at the time.
But it is something that the sheriff wants to ensure that that communication is not intercepted by our personnel and that it'll be protected. So we have that in the current policy, and we'll come back when those updates to the contract are made.
At this point, we'd like to walk through the current process for sharing inmate communications. Captain Durant.
Good afternoon. The classification unit has established a new process for completing requests. This includes verifying the information that is entered into the request form. The process also includes verifying information and utilizing 2 passwords to protect the information that is shared. The new process is an electronic process, which also allows for better tracking of all requests, excuse me, all requests. A couple of things that, a couple important items to point out, that it is incumbent upon the entities who hold privilege to ensure that all phone numbers are registered so that we can ensure that those are deleted and or blocked if necessary. Also, we have added a disclaimer, which you see on the screen there. This disclaimer is part of every email that is sent out, and the disclaimer basically reads that, notice, this email message and or its attachments may contain information that is confidential or restricted. It is intended only for the individuals named as a recipient in the message. If you are not an authorized recipient, you are prohibited from using, delivering, distributing, printing, copying, or disclosing the message or content to others and must delete the message from your computer. Performing any of these prohibited acts could subject you to criminal and or civil liability. If you have received this message in error, please notify the sender by return email. So here you see a copy of our request form that we currently use. We currently use this request form via DocuSign. By utilizing DocuSign, the classification unit can process all requests and maintain a record of all processed requests. And the new form includes verifying all information entered onto the form and ensuring that all requests are handled and returned to the requester within a 48-hour period. If you take a look at the slide above, there is a section on the bottom, where is that? Right? There is a section actually in the form that indicates that there's only one SEN or booking number per request form. So we do allow requesters to submit as many request forms as they wish. We just ask that they limit it to one booking number or SEN per form. And And one more thing I wanted to include that I didn't get a chance to include, that we do have 3 different types of requests. If you look at the top, the 3 most common types of requests are critical, urgent, and standard. However, in all 3 cases, every attempt is made to process all types of calls within a 48-hour period. And if we do run into some issue where it may take longer than 48 hours, we will reach out to the requester and advise them of what the delay is.
And this was part of our discussion with the police chiefs, including with the district attorney, that we would meet that 48-hour time frame, and we have met it. This process, since we implemented the policy with the chiefs, and I have a copy of the policy, I know that it's been provided to you in the past, it's been implemented, it's functioning, and we have met those timelines. There has been an increase in the number of requests that we've received, and we're still within the time frames.
So the process for reviewing the new classification form includes reviewing every form that we receive. We want to make sure that all information on the form has been included by the requester. And if there is something missing, we do have the option through DocuSign to decline the request. However, what we normally do is we reach out to the requester and we simply ask them to verify the information that is missing via an email so that we maintain a record of what was missed and we input it ourselves so that we don't delay the process. Once all the information is verified, we look through the GTL system for the information that's requested to make sure that it's available. A lot of times a request may just request phone calls for a specific time frame, and many times there may not be calls, so we do look to make sure those calls are there before we attempt to process them. Once the calls are located, all calls are placed into a queue, which is a vendor-generated email. All calls go into that protected queue, and we send out an email to the requester. So those calls advise the requester that they have 7 days to open the call with the password that's being generated. We send a second email. The second email has a protected password for the person to open up the first email. And that's done just in case the email is sent to the wrong recipient. Without the password, they can't access any of the phone calls. So we do 2 separate emails to ensure that it's received. Once we send the second password, the requester is able to open the phone calls that they requested, and more often than not, there haven't been any issues with the requester and the information that we provided. They've been able to access everything.
Good afternoon. The Sheriff's Office will work with Legacy when we transition to maintain an electronic process with the ability to restrict privileged numbers. We will share in accordance with our current policy that was approved by the County Chiefs Association. Once we execute an agreement with Legacy, we can provide additional information through updates to the committee and the board. When the tablets go live, day one, being used by in-custody individuals, they will have the capability of accessing educational content coupled with entertainment content, submit commissary forms, grievance forms, have access to the rule book to know the rules of the facilities, and also submit request forms. Subsequent to day one, as we have more time with the tablets, we will introduce phone calls. It is also anticipated that future access will include emails as well as text messaging.
To answer additional questions, we're here to answer any additional questions. I know that there was an attachment added to the agenda, and I would like to, if possible, answer those at some point related to the public defender's questions.
Thank you very much. I want to first confirm that we do not have any public comments on this item. Okay, and if are amenable, Supervisor Wasserman, I'd like to turn first to the Assistant Public Defender to go through some of the questions that were included in the Public Defender's letter, and then see what our questions are after that.
Thank you. I just have a one-word addition on an early page. So I'll be happy to afterwards. Doesn't matter, not going anywhere.
So much.
Thank you. Let me begin by thanking the board and the leadership we've received from the board on so many of these privacy and surveillance issues, and also all the agencies in the county, but including the Sheriff's Department, in their efforts to meet the requirements of that policy. I know from our own experience, it is a tremendous amount of work, and it asks many technical questions, and the Sheriff's Office has been very available, has reached out to us throughout the course of these discussions, including over the weekend, and as we mentioned, even within the last several hours, and we appreciate it. We believe it's a sincere and genuine effort to help answer the questions that we raised. One of the reasons that Molly O'Neill, and with the board's permission, I would invite or ask if I could invite Adam Perez, who is a program manager in the Public Defender's Office, to the desk, because he has helped work and advise both Ms. O'Neill and myself in developing any questions or unanswered issues in this particular discussion. So with that permission, I would ask that Mr. Perez join us at the table.
Welcome.
Let me then just turn to, we felt that there were sufficient technical and detailed questions that we didn't want to just fire these questions from the dais or from the table at either the sheriff or her staff, and that's why Ms. O'Neill and with the help of Mr. Perez and myself developed the later submittal. I believe that the vast majority of those questions have been answered, and I want to thank the Sheriff's Department, one for the amendment regarding the immediacy of deletion in language added to the GTL policy that had been discussed in the past and was of concern for us, as well as outlining the detail of functionality of the tablets at the launching on day one, as we understand it. As much as we would like our clients to have the ability to have additional communication with their families and for all the important rehabilitative purposes that serves, we really want to understand the system and make sure that privileged communication is properly addressed before that functionality is added. And as I understand the statements that I've heard today, as well as in conversation prior to this meeting, there's a commitment by all parties that an amended use policy will be brought forth to the board for full vetting and discussion as we better understand the functionality developed by Legacy regarding the tablets. And that is providing great peace of mind from our perspective and as the voice of the community we serve and the clients we serve. I also understand, and one of the issues that we had flagged was the question regarding the electronic access to the GTL or to the Legacy phone calls. And as I understand it, and one of our concerns was that it not become a slippery slope in essence to direct access, but that would go through not only the similar request process, but would again avoid in essence de facto direct access. My understanding in speaking to the Sheriff's Office is that will not be the situation. Those in essence were the primary concerns I wanted to raise, and I believe that they've all been answered, including I think one final one which is directly addressed in the request form itself on the related to GTL, which was the limitation of a single send request or a single send for each individual request. So having said that, I would briefly turn to Mr. Perez and see if there were additional questions that he felt were outstanding from our office. But I believe with the assurances that we've received, I had no specific additional questions.
I just wanted clarification. Are we simply going to get a report once and if privileged communication is going to be restricted from recording and being listened to and being seen when it comes to text and email on the tablets? Or is there going to be language, is there going to be amended language put into the agreement? Is there going to be amended language put into the use policy? Or are we just going to get a report that now this capability is available?
Let me take a stab at that. Another thing that had been raised by the Public Defender's Office was also, we've talked with Legacy, we spent a lot of time working with them, and they are available to come at a future meeting if you'd like a demonstration or them to answer questions. Very clearly, we will not move forward with any text or email prior to Legacy having a solution where privileged communication can be blocked. And that would also require a contract amendment, and that will come first to the Public Safety and Justice and then to the Board of Supervisors. If the surveillance ordinance that we presented today does need to be amended in any way, we'll do that, but the surveillance ordinance policy that we put forward, we believe addresses it, but if it needs to be done, and I've committed to working with both Molly O'Neill and Damon Silver and the Public Defender's Office to make sure that we have real solid solutions in place prior to those being implemented in working with the vendor and in working with county policies.
Thank you.
Did you have anything further to add?
I think I would add just one final observation or comment, and I don't necessarily want to rehash the many comments I'd made in the past when we were discussing the policies and access to communication and the surveillance of communication throughout the spring and the summer. But I would like to flag again, as really the voice of our clients and the community we serve, that there are some very inherent social justice issues related to all these surveillance and policy decisions. The true fact of the matter is that the majority of people in custody are pretrial, they have not been convicted of any crime, and are presumed innocent. They primarily are in custody because they are too poor to pay for their release, and the reality is that burden disproportionately falls on communities of color. And each of these policy decisions oftentimes feels very small to us as government agencies, but I believe that they have very profound impact on how these communities view the credibility and integrity of our criminal justice system. Many would have said that, for instance, Ferguson really didn't come down to traffic tickets, but upon a deeper dive, those issues were very important to many of the issues that are being wrestled with throughout the country and the nation. And so I would just suggest or encourage us all to be mindful when we're making these decisions, because certainly you have heard from our perspective, we would request that there be judicial review of all release of electronic communication or phone call communication. We believe that that is actually the best policy, but again, we also appreciate the collaboration we've received throughout the county in developing this policy.
I want to add that I think that there's no excessive sunshining to the issue that you just raised, Damon, and it does need to be rehashed and rebrought up, and I think in the front of all of our minds as we continue to develop policy. So thank you for that. And I want to really thank and commend both the public defender and the sheriff's office for working out incredibly complicated issues in a way that is at least generally satisfactory to everybody and allows us to move forward with the tablets that we've been talking about for how many years? long before I got here. So I really appreciate the work of all of you. And you took all my questions. So with that, I will turn to Supervisor Wasserman.
Thank you, and I'm getting the hand signal of 4, that it was 4 years ago that we started this subject. But time flies when you're having fun, huh? On your PowerPoint, if you can go back, it's either slide 2 or slide 3. When I was reading the disclaimer at the bottom, I just felt it appropriate at least to suggest that you insert the word immediately. Let me just go back here. Yeah, if you can go back to page 2 or 3.
Yeah, I'm not sure who's controlling this. Okay, right there. Yep.
And as is my custom, thanks for numbering the pages. They know.
Like I selected it.
And I think the sheriff hit right on it. I just can't.
Yeah, it's the second to the last line at the
Yes,
beginning of the
where you're
sentence.
talking about if this is not meant for you to delete, it should read, I believe it should read immediately delete. Whether or not they do that or not, of course, is up to them, but at least it'll be in writing that we said it wasn't to hang around or share with other people, leave out somewhere where somebody else might come by and see it.
Yeah, and that's really intended also where if the physician does not put their phone number on
Right.
record and someone someone gets it, they have the obligation to immediately delete. And I think we can add immediately in there. That email goes out when we send the phone call information out. That disclaimer is on that email, so that's very easy to change.
All right, are there any other questions or comments on this item?
We're trying to
Not?
get to it, but I think the sheriff referenced what I was saying. I don't know any other way to show it. Okay, not.
Do you still need to
Yeah, it
see
was the one at the bottom where if this is not intended for you, just as the sheriff said, and it was a couple of lines from the bottom, just as the sheriff said, and it was to insert the word immediately before the word delete.
Okay, are you ready to make
Thank
a
you.
motion?
Yes. It's to receive reports. We don't even need a motion.
No recommendation goes to the full board yet.
We are on, that was 6A.
Okay, yep. All right, no motion then. Thank you very much. Moving on to item 6B, I have one public comment. I think I'd like to hear the report first, then take public comment, and then come to committee members for questions and comments.
Thank you. Today, to answer any questions on the report is Captain Bob Durr and Thomas Nguyen. And also present, I understand, is Kelly Tran from Procurement, if we have any questions. She's not there. Okay, it'll be Michelle again. Okay. So if there's any, if there are any questions, or would you like a brief report?
A brief report, please.
Good afternoon. My name is Bob Durr. I'm a captain with the Sheriff's Office. I have worked with procurement to procure the new dash cams to replace the existing models we have, failing models to add. We do not have a formal presentation today, but Axon was the vendor selected through a competitive process, and we have been anxious to award the contract since April. It enhances our capability by introducing new technology that will interface with our body-worn cameras, and which is also Axon. To reflect operationally how we chosen to utilize the dash cams, we have stricken reference to facial recognition software in proposed use policy. We plan to present this on the board October 22nd. I can answer any questions.
Thank you. Do you have questions? Nope. We've got one public speaker, Scott Largent. And if you can hang on a second, we'll set the timer for 2 minutes.
Oh, okay, yeah, no problem. A little quick today. Sorry about that, Nancy. Excited to come up and talk, you know. Okay, great. Thank you. Thank you. The Axion products, I actually really like the chest cameras. When San Jose PD rolled out with them, and then eventually the Sheriff's Department got them, these are great products from a very good manufacturer. Myself, I do the same thing. I kind of have a similar product that's like a chest camera. What we've been trying to do lately is to be legal observers when encampments are being dismantled and taken apart. It's a harder process with San Jose Police Department. You know, we talk a lot that we don't do it as a county level. We don't do sweeps, but we are kind of in on them. We do fund some stuff that the city does. I mean, when you start kind of tracking through it, you realize what's really going on. I would hope with these policies, with these cameras through the Sheriff's Department, that we can respect the right of the public to still also record. And if we set boundaries up and make sure that the public understands a certain distance that they have to be away and that they're actually legally able to record the police, then we won't have those conflicts right there. If you tell somebody, you know, 10 or 15 feet back, you make sure to get that out to the public. I've been running into problems with San Jose Police Department, and they've been trying to shut me down. They've been threatening me. They've tried to take my camera stuff. I picked through their duty manual, and there is a policy and procedure for filming. So it's great. I kind of bring that out there and show people that. I would hope the Sheriff's Department could hopefully do the same thing. I just think we have the right to film, and we should be able to do that. And I'm trying to become a legal observer to film this stuff. It's not to get the police in trouble. It's to protect the homeless community and kind of get an idea of how these sweeps are, what's really happening. Because the videos that I've been able to obtain from homeless people, it doesn't paint a pretty picture. They're not treated right. Their stuff's thrown out. They're threatened. That's not good, and that's why I capture it with this. So, thank you.
Thank you. And we have no other comments on this item? And questions or comments from anyone on the committee?
Just, Bob Durr, sorry.
Hi, Bob.
Just to clarify one more thing, it wasn't an RFP, it was a single source based on an existing contract with
So this contract, originally, we were going to piggyback off of another competitively awarded contract, but the term of that contract was less than the term that we were seeking, and so we approved a single source for this because of the technology so that we could actually extend this for the full 5 years and get the price and negotiated benefits.
Thank you. All right, thank you very much. We will move on to item 6C.
Thank you. And this will be a quarterly report on inmate grievances. And I'd like to introduce Captain Dave Sepulveda, Captain Blanca Hoyt, Lieutenant Antonio Fernandez, who's the Assistant Division Commander at Elmwood, and Lieutenant Joan Nguyen from the Grievance Unit.
Welcome. Can we?
Madam Chair, should we move on to the next item and come back to this?
We can do that, or we can have them present without the slides, or would that not be helpful? You want to just talk it through?
Sure. I take it that the committee already has a copy of the presentation?
We do.
Okay, fantastic. Good afternoon. I'm Captain David Sepulveda, Sheriff's Office Custody Bureau. As we move on to slide 2 in your presentation, regarding the measures of success objectives. We established 3 primary goals. Those goals were to respond to all inmate grievances within 30 days, centralize the review process to provide a more consistent and more meaningful responses, and implement a robust tracking system to analyze and react to complaint trends. To reach our objective, we established a process to have our grievance unit manager regularly monitor trends, the different stages of the grievance process, and a sampling of responses. Based on these objectives, the grievance unit manager meets weekly with the grievance unit staff to discuss areas of improvement where needed, or to provide positive feedback in areas we're doing well. Well, we've added a robust tracking method by incorporating the ACES Inmate Grievance and Appeals Tracking System. We are looking forward to improving the system, as our future jail management system will provide an even more advanced tracking mechanism. I will now turn it over to Lieutenant Nguyen, who will continue the presentation.
Good afternoon, Lieutenant Nguyen, Custody Bureau Grievance Coordinator. So for the second slide, shows our timeliness response. And on this slide, it basically shows all the grievances tracked through the ACES system for the last half of fiscal year 2019, for the last 6 months. So the department strives to make a timely response to each and every single grievance, but some grievances necessitate further investigative measure. More importantly than an instant response, the department strives for the need for a thorough review. So through a thorough review, we feel like it leads to a more meaningful response. So during the last 6 months, we achieved the timeliness rate of 97% compared to the previous 6 months at 91.4%. So we've improved our timeliness response up to 97%. So the remaining 3%, it goes to our investigative units for a thorough review. So for the next slide, shows our meaningful responses. One way we measure meaningful responses is whether a grievance is resolved. If a grievance is resolved sufficiently with a meaningful response every single time, we feel like it won't be appealed. So during the last 6 months, out of 3,151 grievances, only 4.3% were appealed. So during the last 6 months, that's the lowest appeal rate we've recorded in the grievance unit since the ACES tracking system has been implemented. So many grievances are also inmate requests or commissary issues, which have tangible responses. For example, inmate requests, they might request for more cleaning supplies. The deputies in the unit provide the cleaning supplies to the inmates. The sergeant confirms that the cleaning supplies were given to the inmates, and then afterwards they document that, and then the grievance is closed. So that is an example of a request that goes through the inmate grievance system. Another example is commissary grievance. An inmate may order chips or whatever else they would like to order on the commissary, but they don't have sufficient funds. So then commissary would reply and say, hey, sorry, we don't have sufficient funds in your account. You can't order the remaining supplies. For the next slide, we are going to identify some trends that we've observed during the last few years with the inmate tracking system. So since 2017, there's been a 43% overall decrease in total grievances. There's been 30% overall decrease of grievances during fiscal year 2019. Oh, it's up there already. Elmwood men's decreased by 6.5%. Elmwood women's by 23%. Main jail, 52.5% decrease in overall grievances for the last half of fiscal year 2019. And the top 2 grievance categories accounted for 54%, which is medical staff is number 1, and staff conduct and behavior is number 2. So now I'm going to hand it over to Captain Hoyt and Lieutenant Fernandez.
Good afternoon, Blanca Hoyt, Main Jail Commander. The grievance unit began providing monthly detailed reports regarding staff conduct to commanders regarding staff misconduct. It allows to review grievances by facility, watch, team, and even drill down to the deputy level. This allows us to identify issues and to address them in real time. As the main jail commander, I have taken the time to assure inmates that conduct grievances are being reviewed and addressed. This allows us to open up communications and to create a more stable environment. In many instances, we have been able to provide one-on-one training to deputies and inmates on effective communication where there is a perceived conduct issue between inmate and deputy. I'll pass it over to.
Good afternoon, Lieutenant Antonio Fernandez. In addition to the efforts Captain Hoyt addressed, at Elmwood, we've also issued training directives or reminders that are read at squad meetings when we notice a reoccurring issue. We have also been able to have more seasoned deputies work with newer deputies to more closely monitor any conduct or demeanor. For the audit period of September 2018 through August 2019, we have seen the most significant decrease. In September 2018, there were 32 staff conduct and behavior grievances. In August of 2019, there were only 3.
Moving forward, we're going to continue to provide our business units and our facilities with detailed grievance information so that they can continue to analyze that data and continue to work on reducing grievances. We will also be providing our border or PS&J quarterly reports in conjunction with our normal quarterly reports. And we will continue to post our grievance data online. And we were working on adding back the positive comments into the monthly dashboards. And so now we're available to answer any questions you might have regarding this presentation.
Thank you. I'm going to move first to public comment, and I have one card, and that's Christine Clifford.
Thank you. Christine Clifford with PACT and Silicon Valley Debug. First, I want to take the time to thank the Sheriff's Office for extending an invitation to reconvene community meetings with groups who are interested in jail reform and have concerns. This is very much appreciated by the community, by the detainees and their families, and will really help us build on some positive communication. But on grievances, as laudable as the progress is on tracking the grievances, I would encourage a few other considerations. At Debug, they frequently hear from families or detainees that they do not feel their grievance responses address their grievance. Many are also unaware that there is an appeal process. Many say that they have given up filing because they feel that it doesn't help them or that they're listened to, and some actually still fear retaliation. So some additional vehicle for capturing and measuring the detainees' experiences, opinions, and concerns would be helpful and appreciated, as that's not reflected in the current system of data collection. So perhaps this can become a task for the new Ombudsman's Office, and hopefully we'll also be able to discuss this further at our upcoming community meeting. Thank you.
Thank you. And no additional comments? I'm glad to go ahead first.
If I can just make a quick comment. First of all, we're really looking forward to the JMS because the grievance process is a manual process. It involves the inmate putting into a locked box a handwritten grievance, the sergeant picking up the grievance, and then each of those grievances have to be typed in. When we get the tablets, the inmate will be able to directly put that in, directly get the response. And I think when we were talking about tablets earlier, the inmate rule book will be on that. So if there's any confusion on process for grievance and appeals and things like that, that will be more readily available. We're really excited about the tablets. The other thing, if I may mention, we don't thank people enough, and working with procurement has been wonderful. Michelle McCarthy and Teresa Theralis, I'm not sure I'm saying your name right. They've been a real joy to work with, both on the tablet project, the phone systems, and also the cameras. I really want to thank them. That's all. Thanks.
That is good to hear, and I'm very glad that the community meetings are going to resume. The report that we received from the Debug and Pact group, I found to be really informative, too, in terms of different ways of looking at the data, the options to disaggregate the data by site and by gender. And my hope is that as these meetings resume, that the groups can look at data together to find consensus in the way that we're presenting, or the way that you're presenting information to us, so that really we all have a very clear understanding and are looking and are making the same comparisons. I do have a couple of questions that I'd like to ask you. The slides, and you pointed out that 97% of grievances are responded to within 30 days. Do you know what the average time response was? 28 days, 2 days?
Supervisor Ellenberg, we just did an audit not too long ago where we found out that about 70% of all the grievances for the month were answered within less than 5 days. So within 24 hours, there are several simple solutions that we consider that inmate may ask for a pair of sandals that don't fit, that the deputies are giving it right away back to the inmates. Those are all handled within 24 hours, and it was up to like 40%, we believe. And then the remaining 14% were like in the 20 to 30 days. There's a minimal amount of like about 14%.
And do those numbers track similarly across the 3 facilities?
Yes.
Interesting. What happens if an inmate's grievance is not responded to by the time they leave custody? Hopefully many of them are in for far less than 30 days.
We still provide a meaningful response just in case they come back and they ask for the response. And we do track that, we do file it, and we ensure that whoever is answering, business unit, the divisions, they still provide a meaningful response just in case the inmate asks for it if they come back to custody.
And is there a goal of shortening the response time, or does this feel adequate? Is there a high enough level of satisfaction to stay here? And if you were to set a goal to decrease the number of days, would that require more staff time or additional staff? What would that look like?
So one of the things we have to take consideration to is we have grievances that cut across all of our business units, and so sometimes we have to send those out, whether it be medical or programs or mental health, and they have to have time to respond as well. So we have to consider those factors. Our goal is always to provide the response in the most expedient method possible, but we allow ourselves some time to get the meaningful response, because if we feel we push the time too quickly, that we might get a quick response back.
Mm-hmm. Let me ask about the appeal process as well. Is there a similar 30-day, let me start with this, is there a required window within which an appeal needs to be answered?
In the inmate rulebook, once the inmate receives their initial disposition of the first grievance, they have 30 days from that time to file an appeal based on the original grievance. So.
And then do you in turn have a time frame?
Another 30 days for us to.
Another 30 days.
Do a thorough review and provide the inmate back the appeal decision.
And is that decision final, or is there a second tier of review if for whatever reason the grievance still is not?
That decision is final, because at that point, when it comes to an appeal, the division captains, they do look at that with a fine-tooth comb afterwards.
Okay.
To ensure accuracy.
Thank you. I think that addresses all of my questions. I just want to reiterate my hope that that these community meetings will involve working together on data and reporting, so that we are all comfortable with the information that we're seeing and are all able to understand it through the same lens. Supervisor Wasserman.
Thank you. I just wanted to say I'm a numbers guy, and I really like the trend. I like the year over year. I like the direction we're going, and I thank you all in the organizations involved in getting to these grievances, bless you, getting to these grievances quicker. And and getting them resolved sooner. Thank you very much.
And I see that Sylvia has her light on.
Yes, thank you. Again, thank you to the Sheriff's Office for your incredible work. I also appreciated the report very much. And I also want to take advantage of the opportunity to thank all of you for the collaboration that you show us, from Blanca Hoyt to Sepulveda, and all of you, and especially Assistant Sheriff Eric Taylor. All of you have been incredibly responsive to us in the legal community when it comes to addressing the needs of our clients. And I think this is a great opportunity because I know and I recognize the challenge you all have internally in your departments in managing these issues. But it's an important reminder that, you know, all of us have a stake in managing most of the time, that individual that you all supervise. We have them in the legal aspect, you have them in the custodial setting, the community in a personal level. And I do believe very much that the collaboration that we can have together will give you the greatest outcomes. And I can see that based on the way that you're managing the grievances. I do, however, want to know a little bit more about what you consider a meaningful response when it comes to grievances by inmates regarding staff misconduct, because I know that that is the most challenging part for you, but it's also the one that probably has the greatest significance to them, not only in response to the grievance, but how they feel in the setting, and then how they interact with their families, and then how they interact with our lawyer. So could you give us an example, please?
Sure. So we have several types of grievances that concern a staff conduct. It could be a comment made. It could be the way the staff member delivers the mail or the food, or it could be something more serious. So what we do is we want to make sure we analyze what exactly is being complained of, and that our response is directly responding to that specific issue. And while we can't always tell them what the outcome is with regard to addressing a staff member, we want to show that we actually looked at it and investigated their complaint, and then we'll state if we find that there's validity to that complaint through the investigation, we'll say that the staff member has been addressed. In other cases where it's more serious, we'll advise them that we have referred their issue or complaint to a higher level investigative body, such as the Internal Affairs Unit, in order for that complaint to be addressed at that level, and then at that point we'll close the grievance. So we provide that bridge for them.
Okay, very good, thank you.
Any other comments or questions? All right, it's a veritable love fest in here today. It's very nice. Thank you. That moves us on to item 5. And I have 3 public comments cards, so I'll ask for the usual pattern of hearing a brief report, then public comment, and then conversation. Do we have presenters?
Good afternoon. I'm Dr. Woods, Director of Custody Behavioral Health Services, currently in an interim position. So I have a few questions that I will address regarding medical staffing. And one question is, I guess, what is the tracking system that we use to measure our staffing? So currently right now we do have a methodology that we use. Unfortunately, due to the recent changes in custody health services, as it relates to the remedial plan, we actually need to update that methodology. One way we are actually looking to make that happen is to fill up all of our vacancies and strategically place all of our medical staff to actually measure a baseline of workflow to determine if we need any additional staffing support. In addition to that, it was a secondary question that was asked regarding is there a methodology and standards placed by the Institute of Medical Quality. And again, yes, there are standards, and some of the requirements that we try to fulfill is to meet staffing and equipment that may vary. So basically, the staffing and meeting some of the requirements will vary throughout the different institutions that we have. And we also try to meet the criteria by standards that rest upon the various facilities and healthcare of the mission. And primarily that mission is to make sure that we meet whole person care, timely response to access of service requests. The other question was asked to provide information regarding the contracted medical providers. So currently, right now, we have 25 contracted psychiatrists that meet 24-hour coverage, and that includes weekends for the mental health, custody mental health services. Currently, we also have one part-time contracted optometrist, which currently, right now, we are trying to fill the vacancy. We also have been approved for 21 contracted travel nurses. Right now, we have successfully employed 9 for custody health services, 3 per shift. We would have 24-hour coverage. We also have an additional 12 on the way to support medical staffing for the nurses. Another question was posed to us regarding what it looks like for typical volumes of after-hours on call for medical staffing. Currently, right now, the primary care physicians, they take turns doing on-call staffing at roughly 2-week intervals. On-call hours are from 8 a.m. to 10 p.m. 7 days a week, and approximately during the daytime shifts from, I would say, 10 in the morning to 1 o'clock, there were roughly 20 to 25 calls placed. For the nighttime shift, which is 1 p.m. to 10, anywhere from 1 to 5 calls. It can vary. Also, in addition to that, any inmate that has critical needs after hours of 10 o'clock, we will send them to the emergency department at VMC for extensive treatment. Those with less urgent needs will be provided services within the facility or the jail, and then will be provided additional services from the medical doctor on the on-call hours starting at 10 a.m. in the morning. And then a final question was posed to us regarding the current incentive pays and medical staffing working within custody health compared to other counties within Santa Clara County. Well, to be honest with you, I don't have an answer for that at this time. However, I do believe I can get this information from ESA, so I'm requesting to gather this information and provide it to you at a later date. And that is all of the questions.
Thank you very much.
You're welcome.
I've got 3 public commenters, Daryl McKay, Angela King, and Scott Largent. You can all come down.
Come on down.
And you'll each have 2 minutes to share your comments. All the way. Up to the podium there.
Okay.
Great.
Hi, my name is Angela King. I'm a staff RN in the custody setting. I want to let you guys know that we have lost 16 nurses in the past 6 months at Elmwood alone. They are at a critical point that is majorly impacting patient care and the risk for more sentinel events. They have about 500 white cards or sick call slips that are sitting on a desk, and they're trying to get to them as soon as possible. A few days ago, they found buried in the 503 that said a patient was suicidal. These nurses cannot work under these conditions. Us at the main jail, all of us are just, we can't believe it. We have never had to work under conditions like that. They are, on the average, having about 350 patients each. We have maybe 100. And when we collect our white cards, we do extensive assessments. These nurses at Elmwood, they don't have deficits. They have a staffing crisis shortage that is monumental to the risk of every patient in Elmwood. And I know I went over last time, but I have other things that I'd like to talk about, but Sheriff Smith has graciously agreed to meet with staff nurses. Our appointment was canceled, but that was a mistake by her secretary, and we're going to reschedule. But honestly, I'm just begging. I know that Dr. Woods said that they've got, 21 nurses coming in, and I hope 16 of those are going to Elmwood, because those poor nurses are drowning, and patients are suffering because of it. Thank you very much.
Thank you. Can I, before we hear the next public comment, can I ask you, Dr. Woods, of the 29 new nurses, do you know offhand or have a sense of how many will be assigned to Elmwood?
12 approximately.
Thank you very much.
You're very welcome.
Hi, go right ahead.
Hi, good afternoon. Daryl McKay, RN Main Jail, and a union representative for Main Jail. I prepared some comments last night to say staffing at Main Jail and Elmwood continues to be a work in progress. Our current staffing levels are at a critical point to where patient care is compromised. We have multiple staffing issues at crisis levels, which results in immense risk to patient care at all levels, from intake to the dorms to the infirmary. We have multiple equipment failures, such as the new scanning of patient armbands and medications that often result in multiple HIPAA violations when we are having unauthorized access to patients' charts that come up in HealthLink after scanning a custody patient's barcode. As medical and mental health professionals, it is our goal to ensure the best care to the patients we serve and to carry out our responsibilities in a manner that provides the best outcomes to each patient. We thank Dr. Woods for his dedication and his transparency to achieving the best outcomes to the patients in a manner that is safe for patients and safe for our staff. We have a responsibility to ensure appropriate staffing levels in order to provide for the best practices being adhered to. We must have an environment that is conducive for the Sheriff's Department, medical staff, and mental health staff all working together as a united team. We look forward to our continued progress as a united team and look forward to working closely with Dr. Woods and Sheriff Smith so we can achieve the outcomes for our patients and the outcomes that they deserve. We all need to be working together for the common goal of delivering safe and effective patient care. United together, we will prevail, but divided, we will inevitably fail. If I may end with one comment here. If I can quote Henry Ford, coming together is the beginning, keeping together is the progress, working together is the success. However, I prefer to say that coming together is a beginning, working together is progress, but keeping united together is success.
Thank you very much. Scott Largent.
Thank you, everyone. So who does this fall on? Who's responsible? Does this go in Tony Tullis's department right here with behavioral health and as far as staffing? I'm just curious, who do we, not necessarily throw under the bus, but who do we light the fire under right now? I just find that strange. You guys know our reentry center over there, and that was basically through the behavioral health end of things. We were focusing on alcohol, and they're all meth addicts. So we had 20 beds over there, we had a doctor, we had nurses, we had all this other stuff, and we weren't doing the right thing. That was a failure over there. I'm not impressed. So do we start making phone calls after this? Do you guys start, who's going to light the fire? I feel bad for these nurses and doctors out in Elmwood. I also feel bad that they don't have any success stories of people getting off of drugs. I cannot find a success story in Santa Clara County yet. Anybody want to show me one? I don't know where they're at. I'm just worried about this whole thing, so I'll just cut it off at that. I'm disappointed in Santa Clara County.
Thank you. I'll confirm that we've got no other cards for public comment. Supervisor Wasserman.
Thank you, Madam Chair. Dr. Woods, just to clarify a couple things and ask your opinion on one other item. On package page 20, where you've got the charts showing the various vacancy summaries, under medical at Elmwood, you've got a total of 12 nurses, manager nurses, 10 of which are clinical nurses. And I heard you just say out of the nurses coming, you're looking at approximately 12 going to Elmwood.
Correct.
So I heard you say 12 going there. I see on the chart 12 vacancies.
Yes.
And at that moment, at that point in time, given the FTEs, the number of positions you have, you'd actually be 100% full.
That's correct.
Okay. And how soon do you anticipate those 12 being assigned and
We're
starting?
anticipating by next week. We're currently interviewing as we speak at this moment. However, these traveling nurses will be with us for approximately 13 weeks.
Okay.
Within that time, we anticipate roughly for the medical side about 80% of those vacancies filled. Currently, right now, we are hiring, or I do believe we have hired our last vacancy for custody behavioral health nursing. So we're on track there.
Okay, thank you. So in response to this shortfall here, you've arranged the funding and found that the nurses are coming in a week, and at that point, you'll have filled the positions while you're looking to find permanent solutions.
That's correct.
Thank you. On the prior page, under clinician, behavioral health, psychiatric social workers, and I'm just picking the two largest number of vacancies that you've got, where you have 14. Any news update there you can share with us?
Actually, no. I have a meeting with some of my analysts, I do believe tomorrow, to take a look at the vacancies and how we want to approach filling those vacancies.
Okay, and that ties into my third and final question. We each sit on a number of committees. We each deal with a number of department heads, and the hiring, we have something like 1,200 vacancies, funded vacant positions at Santa Clara County. And we often get into discussions with department heads or the county executive and others about how we can speed things up in the hiring process, the time that it takes, the filtering prior to the individuals getting to the department heads for consideration. By the time we get back, the cream of the crop, because so much time has gone by, they've taken a job somewhere else.
Correct.
Do you, in your experience in the jurisdiction that you have, do you have any recommendations that you can voice to supervisors at this time of ways where we could improve the hiring process? And by improve, I mean expedite the hiring process for the particular area that you're in charge of?
Well, from what I'm understanding through custody with the DOJ, it's a longer process to clear the background. And so that usually takes about a month or possibly two. So that's primarily the major holdup for us.
Okay, I'm going to interrupt there. Those requirements that you're saying we're subject to, a month or two, other entities are subject to the same rules, correct?
Correct.
Okay, so is there anything you think, in talking with peers and other agencies, similar position as yours, is there anything we're not doing at Santa Clara County as far as hiring that other organizations you know are doing that we could consider so as to improve ours and have best practices, if you will?
Because I haven't spoken with my other colleagues at different agencies, it's really hard for me to give you a truthful answer.
Okay, I would invite you to do that whenever you have a chance.
Okay.
And if you'll please get back to my Chief of Staff, Christine, with what you find out.
Okay.
Of things that are being done. And I'm always looking for ways, as I know Supervisor Ellenberg is, to improve. And by improve, I really mean expedite. We have a number of qualified people asking to work here. We just don't get them over the finish line, the goal line, fast enough, in my opinion. Thank you very much.
All right, thank you.
I want to ask you about the traveling nurses for 13 weeks.
Yes.
Why this model right now, if we're looking for permanent replacements? Why did we not have traveling nurses in place sooner? And what happens at the end of the 13 weeks if we don't have permanent fills for all of those?
Okay, well, to answer the first part of the question, I have just recently taken on this position, so I have decided to implement, the traveling nurses. So if we do not meet our expected target within the 13-week time, we will probably extend that just a little further. But I'm highly confident that we'll be successful.
All right, that is good news. Thank you very much for the report. All right, I'm sure that everybody has noticed by now that we've made a small change to the structure of the meeting in the form of announcements, brief announcements that don't take us into agenda land, and if we venture there, Rob will stop us immediately. But I've been taking the opportunity to update this committee on things that I've been doing in between meetings that are related to public safety and justice.
Excuse me, Madam Chair. Are we moving on to item number 7 now? The announcements? Is that
Yes,
what you're referring
yes.
to? Thank you.
Yes. So my share this time is that I was part of the Juvenile Hall Utilization Work Group for CSAC that met over the past 4 months to discuss the use of vacant or underutilized juvenile hall beds throughout the state. And the goal of this work group was to create a report and a toolkit that will outline key considerations when addressing the future of our juvenile justice facilities. This report will also include comprehensive information about the history of juvenile justice and the legislative changes that have impacted the juvenile justice population and programming. And I'm hoping that that toolkit and report will be published by January 2020, and we'll be glad to share it out. And we had no public comments on item 7, correct? Okay. Thank you. Getting ahead of myself. Are there announcements or share-outs from any of the committee members? If not, something to think about for our next meeting. If there's nothing else, we stand adjourned. Thank you all so much.